With Marky Martin. Marky, we're talking a lot about masks, of course, at the top of the hour. Where exactly do we need to wear them?
Hey, good afternoon, Adrian. So I'm here at Dallas Love Field. It's kind of a mixed bag. So far, it's about half and half. People deciding to wear them, people deciding to ditch them. And I'll get to where people still have to wear them in just a second. But it's interesting to watch folks walk through these doors, kind of eyes wide, checking to see what everybody else is doing, not really fully believing it yet. And you have people who are celebrating this move, people who think this was the wrong call, and now people who think this is just downright confusing. This was obviously the announcement heard around the world yesterday. For those at airports or even some mid-flight, some of those planes erupted in cheers. But you also have the camp who is worried about this. They're fearful for what the future holds. Even yesterday, White House Press Secretary Jen Psaki calling this a disappointing decision. But here was President Biden today on the matter.
Should people continue to wear masks on planes?
That's up to them.
Would you like to appeal the ruling or the ruling that the judge made striking down the mandate?
I haven't spoken to the CDC yet.
Yeah, so the president seemed to have a bit of a different take there than Jen Psaki just yesterday. And as you mentioned right off the top, Adrian, yesterday's ruling now creating a whole mishmash of transportation mask rules.
Marky, in terms of confusion, despite the Florida judge's ruling yesterday, there are still some hubs that are choosing to enforce the mask mandate. So where do travelers still have to wear one?
Yeah, so this is where it gets tricky and also confusing. Yesterday's ruling basically gave airlines, airports, hubs, ride-hailing services the option, either keep it in place or ditch it. So, for instance, you have New York deciding you still have to wear a mask here on our metro system, at our airport, on our buses. And I will say, Adrian, this is changing quite rapidly. I mean, minutes before we went on air with this newscast, you had Illinois and Seattle change to mask optional. So that's how quickly things are changing. The example I keep saying is if I were flying to New York from here in Dallas, I could be maskless here at Love Field, maskless on the plane. The second I get to that New York terminal, I have to throw one on. And basically, I talked to a law professor earlier this afternoon. He says jurisdictions are just all over the map. Everybody has a different authority that they're checking in with right now. So your best bet still at this point, 24 hours later, keep that mask in your carry-on, in your back pocket. You just don't know yet where you're going to need it or possibly if this decision gets overruled. Adrian.
You know, it's funny, Marky, I'm just remembering I took a Lyft today and an Uber. On the Uber, because they announced they lifted their mask mandates, I didn't have to wear a mask. In Lyft, I still had to wear a mask.
Yep.
So, again, as you mentioned, it's better to be prepared. Thank you so much, Marky. Now, the CDC, of course, had enforced this mandate. They say they base their decisions on metrics. Let's look at those right now. Right now, U.S. COVID hospitalizations, they're way down, according to Johns Hopkins University. We're down to about 15,000 daily hospitalizations. Compare that to nearly 162,000, our all-time peak back in January. Our case counts reflect a similar trend. Many people feel they don't need to wear a mask if they're fully vaccinated. Nearly 67% of the U.S. is fully vaccinated, though Johns Hopkins doesn't actually specify if that includes the booster shot. And the United States actually ranks third in terms of vaccinations globally, just behind China, which is the most vaccinated population, and India. Now, with all that in mind, kids under age 5 still are not eligible for vaccines. So the question is, are they even still at risk? Let's talk to Dr. Kristen England about that. I can imagine, Dr. England, that some parents are skeptical about not having a mask mandate in closed spaces like a plane where you can't socially distance. But should we be concerned? Should parents be concerned if they have children under age 5?
So I think parents with children under the age 5, as well as a number of people who have weakened immune systems, maybe elderly, may have a number of other health issues that put them at higher risk for getting a severe case of COVID, are certainly all, have a right to be concerned at this point in time. And I think it's important for them to always keep a mask in their pocket, if not on their face, so that if they get into a situation where they're uncomfortable, they can put their mask on.
At one point, we saw that children were not at risk. At one point, it really was a situation where adults were most at risk, whether they had pre-existing conditions or not. Then with the very fast-moving Omicron variant, that switched up. And now we have such a small number of cases across the country. So really, what should a parent do if they have any lack of peace about traveling, whether it's on a bus or a train or in an Uber? Should they just mask up because now they have a choice, and really that's all they can do?
I think everybody should feel comfortable masking up at any time. I don't think you need to have an excuse for it. You don't need to explain it to those around you why you want your family and your children to be protected. You also have to know what the trend is in your community. While the numbers overall in the country were going down, they're starting to creep back up now. And let's also keep in mind that those numbers are those tests that were done at a testing center. A lot of people are getting their tests done at home, so those numbers don't get reported to the national services. So there's probably a lot more positive tests out there than we really know about. So keep your masks in hand, put them on your children's face if you're uncomfortable standing in the airport. Help your grandparents with them on as well. We all just need to be kind and accepting of each other, whatever choices you choose to make.
Yeah, kindness rules for sure. But obviously, even if you test at home, we aren't seeing the same number of hospitalizations. We were just reporting the numbers. Only less than 15,000 hospitalizations nationwide. Certainly, there are far fewer cases of serious illness right now in this country, correct?
Absolutely. So the numbers of hospitalizations are down. Thankfully, Omicron was not quite as bad, or the BA2 variant of Omicron was not quite as bad as we thought it was going to be. As far as severity, it's still very infectious. And if you talk to people who've had Omicron recently, it's still miserable. And you're down and out for, a good week or two with fevers and chills. So it is not something that you want to get and just be able to move forward with. You can feel pretty awful, but still be able to stay at home.
It seems that the symptoms have varied. You described how miserable you can feel, and then other people, like the mayor of New York City, Eric Adams, who recently tested positive for COVID, all he had was a raspy voice. So again, depending upon your vaccination status, depending upon your health, prior to being infected, your symptoms could vary. Thank you so much, Dr. England, for joining us.
Thank you so much.
Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.